You wake up with that heavy fog pressing on your temples again, the kind that makes the simplest thoughts feel like they're swimming through mud. Your alarm is already blaring, but your mind feels like it never really powered down. You lie there for a moment wondering why putting on coffee and remembering what day it is suddenly takes so much effort. That fog is not just annoying. It is your brain telling you the nightly cleaning crew did not finish its shift. Those microscopic waste proteins that should have been flushed out are still hanging around, sticking to your neurons and quietly speeding up the damage that can steal your memories, your independence, and the years you want to spend fully present with your grandchildren. I'm Dr. John Lee. For more than 35 years, I have practiced medicine and taught medical students here in the United States. I am 65 now, a Chinese-American doctor who has watched thousands of patients in their 60s, 70s, and 80s dismiss their sleep troubles as just old age. I am here to tell you those troubles are not harmless. They are actively working against the one system your brain depends on to stay sharp, clear, and independent for decades to come. Your brain performs its most important maintenance while you sleep. During deep non-REM sleep, the glymphatic system opens its channels and cerebrospinal fluid rushes through like a powerful river, washing away amyloid-beta and tau proteins. These are the exact proteins that clump into the plaques and tangles we see in Alzheimer's disease. When that river runs strong and long enough, your memory stays sharper, your thinking stays quicker, and your ability to live on your own stays intact. One single night of poor sleep can double the amount of amyloid-beta in critical brain areas. That is not theory. That is what imaging studies have repeatedly shown. Over months and years, the accumulation becomes dangerous. The good news is that sleep is one of the few major risk factors for cognitive decline that you can actually control starting tonight. I'm going to walk you through the 9 most common sleep mistakes I see in older adults. These are the ones that quietly rob your brain of its cleaning time. Correcting even 2 or 3 of them can dramatically improve how well your brain clears waste and how clearly you think during the day. We will talk physiology, real patient stories from my clinic, and exactly what you can do about each one. Because this is not about feeling slightly better tomorrow. This is about protecting the next 10, 20, or 30 years of your life. Let's start with how the brain actually cleans itself, because once you understand the machinery, you will never look at sleep the same way again. While you are awake, your brain is a busy factory. Every thought, every memory formed, every decision made produces leftover proteins and metabolic trash. During the day, those waste products build up between brain cells. When you fall into deep sleep, your brain cells actually shrink a little. This creates space for cerebrospinal fluid to surge through, carrying the toxins out through channels that drain into your bloodstream and eventually your liver. The deeper and longer that slow-wave sleep, the more thorough the cleaning. Amyloid, beta, and tau are especially toxic when they linger. Amyloid beta begins to form sticky clumps that interfere with communication between neurons. Tau twists into tangles inside the cells and eventually kills them. The hippocampus, the part of the brain that helps you form new memories and remember names and faces, is particularly vulnerable. When that area gets gummed up, you start forgetting why you walked into a room, you repeat the same story to your daughter twice in 10 minutes, or you lose confidence driving to the grocery store you have visited for 30 years. Research from major universities has made this connection crystal clear. Adults who consistently sleep less than 6 hours show significantly higher amyloid deposits on PET scans. Those who protect their deep sleep show slower accumulation and better cognitive scores years later. The mechanism is no longer debatable. Poor sleep equals faster buildup. Better sleep equals faster clearance. Many patients ask me whether poor sleep causes dementia or whether dementia causes poor sleep. The honest answer is that both happen. Disrupted sleep can accelerate protein buildup, and early protein buildup can disrupt sleep. But here's what matters for you. Improving sleep quality right now slows the process no matter which direction the arrow points. You have the power to change the trajectory. That is why we are going deep on these 9 mistakes. Let me tell you about Mr. Chen. He was 78 when he first sat in my exam room, looking tired but still smiling. Retired engineer, proud grandfather of 4, active in his local Chinese community association. Over 2 years, I watched small changes appear. He forgot his youngest granddaughter's ballet recital date, even though he had marked it on the calendar. He told me the same joke about his golf swing 3 times in one visit. He kept misplacing his reading glasses and getting frustrated. When I asked about sleep, he shrugged and said, "Dr. Lee, I just don't sleep like I used to. I wake up 4 times a night to use the bathroom. Sometimes I lie there for an hour before I drift off again. I take a 2-hour nap every afternoon because I'm exhausted." He believed it was normal for his age. What he did not know was that his brain was not getting the sustained deep sleep it needed. His glymphatic system was running at half speed. The amyloid and tau were not being cleared efficiently. We mapped out his sleep habits, found 4 of the mistakes I am about to describe, and created a plan. 6 months later, his wife told me he was remembering names again, finishing crossword puzzles without frustration, and had the energy to take the grandchildren to the park without needing a nap afterward. His head felt lighter, he said. That is the phrase many patients use once their brain finally gets consistent nightly cleaning. Stories like Mr. Chen's are common in my practice. They show that the brain remains responsive even in our later years when we give it the conditions it needs. So let's get specific about the mistakes that prevent those conditions. The first and most common mistake is chronic short sleep, consistently getting less than 7 hours. Many older adults believe they need less sleep as they age. That belief is simply wrong. Your brain still requires 7 to 9 hours for complete waste clearance no matter how old you are. When you survive on 6 hours or less, you truncate the later sleep cycles where the deepest slow-wave sleep occurs. The glymphatic system never gets enough time to do its full job. Think of it like running the dishwasher for only 20 minutes instead of the full 2-hour cycle. The dishes look cleaner, but the grease is still there. In your brain, the amyloid-beta levels keep climbing. Patients tell me they feel okay on 6 hours. What they really mean is they have adapted to a lower level of function. They have normalized brain fog, slower reaction times, and weaker memory as their new baseline. I have seen this in patients who proudly announce they wake at 4:30 every morning like clockwork. They read or watch television until midnight and think they are fine. Their brain scans and cognitive tests often tell a different story years later. What you can do is treat sleep like a non-negotiable medical appointment. Pick a bedtime and wake time that gives you at least 7.5 hours in bed. Keep that same schedule every day, including weekends. Your circadian rhythm thrives on consistency. If you currently sleep 6 hours, add 15 minutes this week, another 15 next week. Move your evening wind down earlier. Stop eating heavy meals 3 hours before bed. Create a cool, dark bedroom. Most patients are surprised how quickly their body adjusts once they stop fighting their natural need for 7 to 8 hours. The second mistake is fragmented sleep, even when you are in bed long enough. You fall asleep at 10, but you are up at midnight, 2, 3:30, and 5. Each awakening forces your brain to climb back through the sleep stages from the beginning. You rarely reach or sustain the deep stages where glymphatic clearance peaks. It is like trying to mop the floor, but someone keeps spilling water every 2 minutes. The job never gets finished. Common causes in older adults include untreated sleep apnea, restless legs, prostate issues in men, overactive bladder in women, chronic pain or anxiety that spikes at night. Each interruption also triggers a small stress response that releases cortisol, which further fragments the next cycle. Over time, this creates a vicious loop of poor clearance, higher protein burden, and worsening memory. One of my patients, Mrs. Wong, 72, swore she was in bed for 8 hours but felt exhausted every morning. Her husband finally admitted she stopped breathing dozens of times a night. We will talk about apnea in a moment, but the fragmentation itself was destroying her deep sleep. To fix fragmented sleep, you must first identify the cause. Keep a simple sleep diary for 2 weeks, noting exact times you wake and what seems to wake you. Bring it to your doctor. If nighttime urination is the issue, stop drinking liquids after 7 p.m. and elevate your legs for 30 minutes in the early evening to reduce fluid pooling. For pain, work with your physician on better management that does not involve sedating drugs. Simple relaxation breathing, 4 seconds in, 6 seconds out, can help you slide back into sleep faster when you do wake. The goal is longer, unbroken stretches of deep sleep so the cleaning river can run strong. The third mistake is long-term reliance on sleep medications, especially benzodiazepines and the so-called Z drugs like zolpidem. These medications do not produce natural sleep. They sedate the brain and suppress the very deep, slow-wave stages where glymphatic clearance is highest. Large longitudinal studies have shown that older adults taking these drugs long-term carry a 72% higher risk of developing dementia compared to those who do not. I have had too many conversations with patients who started a pill for occasional insomnia and stayed on it for years. They wake up groggy, their balance is worse, they fall more easily, and their memory complaints slowly worsen. The drugs create dependence. The brain forgets how to fall asleep naturally. Worst of all, they rob the brain of the exact restorative process it needs most. If you currently take these medications, do not stop abruptly. That can be dangerous. Work with your doctor on a slow, supervised taper while you build better sleep habits. The gold standard treatment is cognitive behavioral therapy for insomnia, or CBTI. It is more effective than pills for long-term sleep improvement, and it carries zero increased dementia risk. CBTI teaches you to change the thoughts and behaviors that keep insomnia alive. Many of my patients complete a 6-week program and never need medication again. Their brains finally get the deep sleep they were missing for years. The fourth mistake is untreated sleep apnea. This one is particularly destructive. Your airway collapses dozens or hundreds of times per night, oxygen levels crash, then spike. Each episode triggers a surge of adrenaline and inflammation. The brain is literally starved of oxygen repeatedly while the body is supposed to be restoring itself. Sleep apnea is strongly linked to both Alzheimer's and vascular dementia. The repeated oxygen drops damaged blood vessels that feed the brain. They also destroy sleep architecture, so deep sleep almost disappears. Many patients have no idea they have it. Their partners hear the loud snoring and gasping, but the patient only notices crushing fatigue, morning headaches, and rising blood pressure. I remember Mr. Patel, a 69-year-old retired accountant who came to me because his memory was slipping. He fell asleep during movies, nodded off at red lights, and his wife refused to sleep in the same room because of his snoring. His sleep study showed he stopped breathing 47 times per hour. Within 3 months of starting CPAP therapy, his energy returned, his blood pressure dropped 20 points, and his wife said his memory was sharper than it had been in 5 years. The brain finally received oxygen and deep sleep at the same time. The difference was dramatic. If you snore loudly, your partner says you stop breathing, or you feel exhausted despite spending enough time in bed. Demand a sleep study. CPAP is still the most effective treatment. Yes, it takes getting used to, but the mask that delivers steady air pressure keeps your airway open so oxygen flows and deep sleep returns. Many patients tell me it is the single best thing they have done for their brain and heart health in decades. Oral appliances or surgery can be options for some. The point is, do not accept snoring as normal. It is a distress signal from a brain that is struggling every single night. The fifth mistake is an irregular sleep schedule. Your brain runs on a circadian rhythm that anticipates when it should release melatonin, when body temperature should drop, and when the glymphatic system should ramp up. Constantly changing bedtimes and wake times is like moving to a new time zone every few days. The system becomes confused. Melatonin release is delayed. Deep sleep decreases, waste clearance suffers. This is especially common after retirement when the external schedule disappears. People sleep until 10 one morning, go to bed at 1 the next night, nap randomly. The brain loses its cues. For older adults whose circadian rhythms are already less robust, this mistake accelerates cognitive decline more quickly. Set a fixed wake-up time every day, even weekends. Get bright light within 30 minutes of waking. Eat breakfast at roughly the same time. These anchors stabilize the internal clock. If you need to shift bedtime earlier, move it by only 30 minutes every few days. Your brain will reward you with stronger melatonin signals, deeper sleep cycles, and more efficient nightly cleaning. The sixth mistake is excessive daytime napping. Especially long naps after 3 p.m., a 20-minute power nap can be helpful. But 2-hour naps in the afternoon steal sleep drive from the night. You then have more trouble falling asleep at 10, wake up more during the night, and the cycle repeats. Many seniors fall into this trap because nighttime sleep is already poor. They nap to survive the day and unknowingly make the night worse. The brain never gets a long consolidated sleep period. Glymphatic clearance stays incomplete. Treat daytime exhaustion as useful information. It is telling you the night is not restorative. Limit naps to 20 minutes before 2 p.m. or eliminate them entirely while you fix nighttime habits. Replace long naps with a short walk, gentle tai chi, or conversation with a friend. Protect the sleep pressure that builds during the day so it can be properly released at night. The seventh mistake is bright light and screen use close to bedtime. Blue light from phones, tablets, and television suppresses melatonin production by up to 50%. The brain thinks it is still daytime. Sleep onset is delayed and the depth of subsequent sleep is reduced. The mental stimulation from news, emails, or social media keeps the nervous system alert when it should be winding down. Create a digital curfew at least 90 minutes before bed. Dim the house lights. Read a physical book. Listen to soft music. Practice gratitude journaling or gentle stretching. Many patients resist this at first, but within 2 weeks they fall asleep faster and report noticeably clearer thinking during the day. The brain finally receives the darkness signal it evolved to expect. The eighth mistake is using alcohol as a sleep aid. A glass of wine may relax you and help you pass out. But as the alcohol metabolizes, it causes rebound wakefulness in the second half of the night. It suppresses both deep, slow-wave sleep and REM sleep. The glymphatic system is starved of its best working hours. Alcohol also relaxes throat muscles and makes sleep apnea worse. I tell every patient the same thing. Alcohol is a sedative, not a sleep aid. The sleep you get after drinking is poor quality and leaves your brain dirtier in the morning than if you had stayed sober and fallen asleep naturally. Replace the nightcap with chamomile tea, a warm bath, or 10 minutes of slow breathing. Your brain will show its gratitude with better memory and steadier mood. The ninth mistake is ignoring persistent insomnia for months or years. Chronic insomnia drives systemic inflammation, raises stress hormones, and directly impairs glymphatic function. The brain stays in a low-grade fight-or-flight state that prevents deep restoration. The link to Alzheimer's is well documented. People who suffer untreated insomnia show faster accumulation of amyloid and faster cognitive decline. You do not have to live with it. CBT-I remains the most effective treatment. It has no side effects and the benefits last for years. Combine it with the other habits we have discussed and most patients see major improvement within weeks. One woman in my practice, Mrs. Liu, had taken sleeping pills every night for 14 years. After tapering off under supervision and completing CBT-I, she slept through the night naturally for the first time in more than a decade. Her word finding improved. She started playing mahjong again with friends because she could remember the tiles. Her family noticed she was back to her old self. We have covered a lot of ground. You may have recognized yourself in several of these mistakes. That recognition is the first step toward change. The brain remains remarkably plastic even into our 80s when we give it consistent deep sleep. I have watched patients regain the ability to learn new skills, remember family stories, and maintain their independence simply by protecting their nightly cleaning cycle. Start with the 1 or 2 mistakes that feel most relevant to you. Maybe it is protecting a consistent bedtime. Maybe it is finally scheduling that sleep study. Maybe it is committing to a 6-week CBT-I program instead of reaching for another pill. Small, consistent changes compound powerfully over months. Remember Mr. Chen. Once we fixed his sleep apnea, stopped the long afternoon naps, stabilized his bedtime, and got him off unnecessary medication, the fog lifted. He told me one day, "Dr. Lee, I feel like someone turned the lights back on in my head." That is what proper glymphatic clearance does. It turns the lights back on. Your brain is the most sophisticated organ ever created. It has carried you through a lifetime of work, love, and family. It deserves the nightly support that only good sleep can provide. Protecting it is not complicated, but it does require intention. Take a moment right now and ask yourself which of these 9 mistakes you are making most consistently. Write it down, then pick one concrete action you will take tonight. Maybe it is turning off the TV an hour earlier. Maybe it is calling your doctor tomorrow to discuss a sleep study. Each decision is a vote for clearer thinking, stronger memory, and more years of independence. I want to hear from you. In the comments, tell me which mistake hit home or what single change you are committing to this week. Your story might encourage someone else who is struggling. If this video gave you new understanding, please share it with a friend or family member who might be quietly worried about their own memory. Take care of your sleep the way you would guard anything precious, because your brain's future depends on it. This is Dr. John Lee. Sleep deeply tonight. Your mind will thank you tomorrow and for many years to come.